Hey, Missouri City, it's Dr. Anderson at Life Essentials Chiropractic. Guys, today I want to talk about one of the questions I get almost every day with patients starting their corrective program when they have an injury, they have a symptom, they have an issue with their neck, their back, their sciatica, their disc, whatever they're feeling. They're asking me, should I or should I not be exercising? And guys, let me give you some guidelines. The situation is unique to every condition. So I can't give you, an end all be all answer today, but I'll give you some guidelines that make common sense. For one, the short answer is yes. If you can safely exercise, you should definitely be exercising. The spinal joints in your body are designed to be in an upright posture. They're designed to be moving. The discs in the joints need to move through all the active ranges of motion. Otherwise, they become fixated and stuck. They get stiff and achy. The muscles around it get stiff and hardened and knotted up and over time. And the motion of the spine is what creates that pumping mechanism to keep the disc healthy, hydrated, and soft and squishy so they don't get hard and crackled and blown out over time. So motion is critical, and the best way to get full body motion is exercise. But another thing is core strength, right? So when we're talking about moving and training a spine back into alignment, we need to capture that alignment with stability. And we give you specific corrective exercises that are gonna be customized for you as part of your evaluation in your care program here that you can do at home. And we usually give you instructional videos and equipment and tools and all the stuff you need to rehab your spine. But you need to be doing general physical fitness to keep the muscles strong and toned and healthy to hold the changes over time. And another one that is really important is weight gain. If you're sedentary and you start gaining a lot of weight, sometimes the problem with someone's low back is actually in the front, and we need to work on the front to fix the back, right? So if the belly is pulling really hard, or you have excess tissues on the joints, the Mayo Clinic showed that just 1 pound of extra weight on the body can equal up to 4 pounds of extra weight stress on the joints, especially on the knees and hips, and even on the spine can be affected by extra weight. And the last one that comes to mind is inflammation. So guys, chronic inflammation, when every single thing is stiff and achy and all the muscles hurt and there's trigger points everywhere and all the joints are stiff and achy and you gotta kind of move around like the Tin Man to get things moving in the morning or to be able to work out effectively, a lot of times that's just chronic inflammation. You can handle that through nutrition, but you can also handle that just through motion. Your body needs that circulation and blood supply and lymph fluid, and it needs to pump and flush the tissues and keep them soft, not stiff and inflamed. So guys, some basic guidelines are, if you're doing something sharp or stabbing or burning or spasming or going numb down your arm or leg, then you probably need to stop that movement and see what's going on. But if things are just usually stiff or tight or achy, most of the time you're not injuring yourself. You can kind of work through it and loosen things up. If it's too unbearable, you can go try a different type of movement that maybe is a little less uncomfortable, but usually that's gonna be good to work through that. So those are the general guidelines and tips, and I hope that helps.